I invite Dr. Leanne Campbell to present her views on what are the key moments of change in marital and family therapy.
Thank you all. Thank you so much for having me and for that introduction. I understand we have about 3 hours, so I will give you my overview in a few minutes, but I had planned for that, so hopefully that's okay. And lots of video, and we can discuss as you see fit. So, EFT, some of you know, was developed by Dr. Susan Johnson and Les Greenberg in the 80s. And once Sue finished her doctorate, then she moved to central Canada, to the University of Ottawa. And it was soon after she started her tenure in academia that I then moved from the west coast of Canada, which is about a 6-hour plane ride, and began studying with her. So that was really at the beginning of EFT. So it was exciting times. We were able to work with her in some of those early studies. I was a therapist among some of my colleagues, and we would tape every single session, and then she would study them and code them and try to make sense of what are the key moments in change and how do we refine this model. And since that time, of course, it's grown. Scientific support has mounted, and about a few years into my tenure in academia, once I finished my doctorate work in Ottawa, I moved to the west coast of Canada, to Vancouver Island, Nanaimo, and she phoned and asked me to become a trainer. So that was another great opportunity. And at that time, there were maybe a handful of trainers. And now, EFT is throughout the world, as you know. There are many trainers, more than 30 for sure. Many of the resources have been translated into multiple languages, including Hold Me Tight. And Sue continues to write prolifically, and is a very charismatic and engaging speaker as well. So, now, continuing to live on the west coast of Canada, and I think it was part of the introduction that you've already heard, I'm still an affiliate of that local university, but I also have a private practice, along with Dr. David Fairweather, that you'll meet on video later. And he also was a student of Sue in earlier times. And we have a practice now of about 16 clinicians and 5 staff, where we provide EFT, but we also provide all kinds of other things. So in terms of my own work, I work mostly in the areas of trauma and couple therapy, and I work with various populations, including the military, first responders such as police, paramedics, fire, and with injured workers. So this is I also provide training, of course, and this, I am pleased to say, is my 3rd time in Slovenia, and I love your country. It's very beautiful. So I provide training here and in the United States and Canada, and I'm pleased to have been invited here to Slovenia to provide some training by Albert and Leanne Campbell for the 3rd time, and I'm so grateful to Drago for inviting me here tonight. And so pleased to be here with all of you. So thank you so much for this opportunity. So in terms of an overview, first I'll start with what is EFT, and I'll just summarize the research briefly. Then I'll look at how do we see marital distress through the lens of an EFT therapist. I'll talk about the classic pursue, withdraw cycle of distress that some of you might be familiar with if you've done some reading or even working from another approach as well. And then I'll talk about the key moves and key pivotal moments in terms of EFT. So there's 5 key moves that EFT therapists will do over and over again throughout the course of therapy. So we're going to spend some time on that with some rich case examples that I again thank Drago for in terms of helping me with subtitles, and Dr. Fairweather as well, and Matt Engelstorp, someone that I've worked with. He's from Germany, but I met him in San Diego when I was presenting in 2010. So what is EFT? How many of you have done a little little bit of reading about EFT. Some familiarity? Yes? Okay, good. Excellent. So this is repetitive, so I won't say much about this. It's a 9-step, 3-stage process for moving couples from a distressed to a secure relationship. So in EFT and in attachment theory, of course, we consider relationships bonds. And EFT addresses the security of the bond and the partner's abilities to be accessible and to be responsive to each other. Are you there for me? Accessible, responsive, engaged. Key question in couple relationships, all kinds of relationships around security. It's also a comprehensive theory of change with clear interventions. So therapeutic change involves a new experience of the self and the partner and new relationship events. For those of you, or for people who aren't familiar, these are just words. I will demonstrate this with some rich video, I think. And emotion, as per the term, emotion-focused therapy, is both the target and the agent of change. So, in terms of empirical validation, it's now almost 30 years since EFT was developed, and there's a substantive body of literature that substantiates this approach in terms of working with couples and with families. So we know that EFT is effective in helping couples in which one or both partners are struggling with a variety of difficulties. For example, PTSD, depression, terminal illness, loss and grief. So in terms of my practice, I feel privileged to be able to help people that often come for marital therapy but are struggling with PTSD commonly, grief and loss as well, and depression. And it's so rewarding and so powerful. Research studies show that between 70 and 75% of couples will move from distress to recovery, and about 90% will show significant improvements. So it works. Sue's most proud, well, she's proud of all of it, of course, but among some of the most exciting new studies are those that have looked at the powerful impact of simple hand-holding under conditions of threat. So this first study that I refer to, you might be familiar with James Cone from the University of Virginia. To summarize briefly, the study involved putting happily married women inside an MRI machine with the aim of measuring their brain activity under conditions of threat. In particular, once in the machine, the woman saw small circles and X's flash before their eyes. And they were told that whenever they see an X, there was a 1 in 5 chance that they would be shocked, hence the threat. After the shock, they rated how much it hurt. And there were 3 conditions. Either they were alone, they were holding the hand of a stranger, a male experimenter, or they were holding their husband's hand. In this study, all of the women described their marriages as relatively positive, but there was some variability in terms of how positive they were. And then the neurological activity in the brain areas that regulate emotion and bodily arousal were measured. What they found is that marital quality was a key factor. So alone, these women's brains lit up like the 4th of July, Sue says, with signs of alarm at the sight of an X, and they rated each shock as extremely painful. Holding their husband's hand, however, calmed them, and this was particularly true in highly satisfied marriages. Their brains barely reacted to the warning X, and they described the shock as uncomfortable. But holding any hand was better than holding no hand at all, which makes sense, doesn't it, in terms of what we know about the research literature more generally around social support and how people cope with stress and with trauma. So to conclude, Cone and his colleagues said that under threat, connection with a person to whom we feel securely attached is our most efficient way of regulating distress. Sue and colleagues then followed this study up to see, now what does this look like in marital distress? So similar conditions. Jump ahead here. So prior to engaging in a course of EFT, their responses in the MRI indicated that holding their husband's hand offered little or no protective effect. After 20 sessions of EFT, however, their alarm response was muted. In other words, there was less neurological activity, and they rated their pain as merely uncomfortable. So to conclude, Sue, did a happy dance, as she says, and indicating that the results suggest that EFT changes attachment security, which is of course the aim. And there have been studies to demonstrate this over the years with self-report questionnaires and interviews and so on. But to have this kind of biological substantiation is really exciting. So as you know, and you're familiar with attachment, secure attachment offers a safe haven. Holding the hand of another, and particularly a significant other in a strong bonded relationship, tranquilizes the nervous system under conditions of threat. Wow, that's exciting. But on the other hand, distress in our most important relationships has been shown to be associated with a host of risk factors, including, among other things, clinical depression, diminished immune functioning, slower recovery from heart disease, and poorer outcomes post-cancer diagnosis. So it's important. Marital therapy, couple therapy, relationship therapy is important. Our key relationships are among our most important resources in managing stress of all kinds and in negotiating various developmental transitions such as childbirth and/or challenges such as loss or personal, childhood, and/or parental illness. So turning now to look at how we see marital distress from an attachment perspective, I'm going to introduce you to two American TV personalities, one in particular, Larry David. He's also the author of Seinfeld, some of you might know, or the writer of Seinfeld, and he's very, very bad. You have to be prepared for just how naughty he is, but it'll demonstrate the classic pursue-withdraw cycle. So here he is.
Yeah, it's a 3-hour difference in...
You should go to take a nap.
Oh, I'm too wound up right now. You know little Griffin, my youngest nephew?
Yeah.
And he wanted to play on the stairs, and my sister's like, no, that's too dangerous. My mom says, oh, I've raised 4 kids. Like, why don't you just watch your game?
Come on, it's the last 2 minutes. I'll be right up, okay?
Man, they shoot themselves in the foot every single time they do this.
Well, I'm sorry about what happened downstairs when you got home. I was watching the game, and it's like the last 2 minutes,
That's fine.
Doesn't sound like it's fine. That's, I'm sensing rancor. Or is it rancor? Rancor? I know I spell it.
Larry, please, it's fine. I don't know what you want me to say right now.
Well, how about, honey, I forgive you. Would you like to have sex? How about that? Or any combination of that. Either the forgiveness or the sex. Of course, both would be great. That would be ideal. I'm not expecting both. Hey, if you were watching the Oscars or something, okay, and they were about to announce the Best Actress category, and I came home, I would say, no, sit down, finish watching it.
I think if you had been gone on a trip, I could make 2 minutes for you to listen to what happened and see how you're doing.
If it was in the third quarter, easily, I give you 15 minutes. But we're in the last 2 minutes of the game. They've got the ball on the 35-yard line.
Well, the moment has passed. There's nothing we can do about it now.
Okay, so how do we see this through the lens of an EFT therapist? Of course, he's much more extreme than anyone we see. But Cheryl's been away, she misses him, she's reaching for emotional contact, she wants to tell him about her trip, about the kids, and he rebuffs her. He's too busy with football. So later, still hurt, Larry reaches for Cheryl for physical intimacy and or forgiveness, ideally both, he says, and she's still hurting from the earlier events of the day and pulls away from him. That actually is quite classic in terms of what we see when couples are distressed. That from an EFT perspective, this couples dance is consistent with the classic pursue-withdraw pattern that we see in many couples. So if Larry and Cheryl continue on this path, the more inaccessible, unresponsive, unengaged, unavailable he is, the more likely it is that her reaches will turn into criticism, blame, protest, right? Attachment protest. And the more that she protests, the more that she reaches for him in these ways that, of course, will never work, the more that he is likely to pull away, to withdraw, to disengage. And the more that that happens, then the more entrenched that cycle of distress becomes. So there are other cycles, but that's the classic cycle that we see in couple therapy and that we'll focus on tonight, and we'll look at some video around that as well. So let's talk a little bit more about that cycle. So moving away from this pattern in terms of the TV personalities, what do I see when people come to my office? What are the words that wash over us in those initial sessions? And this has been well studied by Sue over the years. And if you begin to listen for this, you'll hear consistent themes, I think. Pursuers will say, "You're not there for me. I'm alone in this relationship. I'm the last on your list of priorities. I don't matter. Excuse me, I'm not important to you. I can never get through to you. We can't communicate." But on the other hand, withdrawers have their own positions, of course. And now we see Larry watching Seinfeld, his favorite show, I assume.
But man wants to make this woman happy, wants to do it, doesn't know how to do it. Sometimes we do it, don't know how we did it. Can't ask, what did I do? Looks like you don't know what you're doing. Can't do nothing. Woman says, I can't believe you're doing this. Man says, doing what? Woman starts crying. Man says, I didn't do anything. Woman says, exactly.
Okay, so what do withdrawers say? What would Larry say? I can't do anything right, nothing is ever good enough, I'm constantly criticized, he, she overreacts, I don't understand the problem here, what's the point? And also in EFT, and again for those of you who are familiar with this field, we talk about secondary and primary emotions. So on the surface, the classic withdrawal pattern is frustration, exasperation, anger, and for the withdrawer, of course, hence the term, numbing, detachment, distancing, withdrawal, and anger. So it's like the flight or fight response, right? When she pushes for contact with me in ways that leave me feeling worse about myself, my two choices, my visceral response, is to either withdraw, numb, detach, or to fight back, and hence the pattern escalates. So in those cycles, when people initially come to the office, it's confusing. It's hard to know who's the pursuer and who's the withdrawer. But when you de-escalate the cycle to some degree, it becomes quite clear. And below the surface, of course, and this is not happening, they don't talk about this stuff because it's not safe. A marital distressed relationship is an insecure bond. So nobody talks about what's happening below the surface. So below the surface for the pursuer is anxiety, for sure. Anxiety about losing the relationship, anxiety about being alone, anxiety about not being able to reach him, to connect with him or her, fear of abandonment or having an unreliable partner. And for the withdrawer, it's often feelings of inadequacy, fear, sadness, anger, anxiety. And the unmet attachment needs that are driving this whole thing For the pursuer is like a need for connection, and for the withdrawer, a need for acceptance. So when you have that roadmap as a couple therapist, it becomes much easier to try to disentangle and focus your energies on moving forward in the process. So again, we'll show a bit of that. So to cite Sue, underneath all the distress, partners are asking each other, can I count on you? Are you there for me? Will you respond to me when I need you? When I call? Do I matter to you? Am I valued and accepted by you? Do you need me? Rely on me. Okay. So let's take another look into the lives of these TV personalities. And this is the worst. This really is. Brace yourself. He's very bad.
So what about the TV?
Well, I don't think it's your TiVo. It's probably the satellite. But take a look, Sal.
Okay. You know, it just gets a little frustrating every time I sit down and watch it. It's not working. Hello?
Larry!
I think you couldn't call.
At a worse time, I got the TiVo.
Oh my God!
Yeah, you got the warranty on this thing? The warranty?
Wait, hold on. What?
We're going through a really big storm right now.
Hold on.
I need a warranty card.
Honey, let me ask you a question. Do you know where the warranty card is on the
Listen,
TiVo?
in case something happens to me. I mean,
Let me ask
it's
you a question. Is
really
the
bad.
kitchen drawer by any chance?
What?
I'm sorry, I can't hear you. What's that? What'd you say?
Do you know who the guy
No,
was
I'm
who
not
came up?
talking to you.
Larry, I just want to tell you, just in case for some reason I don't make it.
You know who the guy was who came up?
You know the guy was who installed?
I don't know. I don't know his name.
Was it Tom or something? Or Don? Something like
Bill
that?
or James?
Oh my God.
I'll come back later this
What?
afternoon
Oh,
because it
no,
looks like you're really busy.
Honey, I'm sorry. You know what? God, please,
He's gonna go. I'm not gonna get him again. No, stay right there.
call me back in 10 minutes, okay?
I'm sorry, sweetheart.
Keep talking, I'll come back.
No, that's okay. Stay right there.
Larry!
Holding the hand of a stranger. Yes, so they have not been to EFT yet. And if they have, he's not listening. So now, assuming that Larry and Cheryl might go to EFT, what do we do with this couple? What do we do with couples like this that are in this classic pursue, withdraw pattern of distress? As noted above, EFT provides a roadmap, a 3-stage, 9-step process for addressing the security of the relationship bond, and also for addressing attachment injuries. So in EFT, we talk about times of particular need, like this, when we reach to our partner and he or she is not there. That leaves a scar, a much bigger scar than when he didn't pay attention watching football, of course, right? This is a time of distress, and she reaches to him and he's not there. So, like the classic study showed, the results showed, she reaches to the hand of a stranger and is soothed by that. The study shows that she's actually soothed by that. So, these roadmaps for distress and injuries are now clearly delineated in a huge amount of resources available through ISEFT and so on. Some of you are familiar with them. And also there's lots of training programs as well. So, what do we do in EFT? What are the key moves? So as I mentioned earlier, I'm just going to focus on 5 key moves that we use over and over again in therapy. I'll review them and then I'll show you some case examples. And when you watch the tape, listen for these moves and for process versus content. And what the key moments are in terms of shifting the cycle from distress to security. So initially in therapy, when Cheryl and David come, for example, or Larry come, we want to ask what's happening for each of them. What happens when he rebuffs you? What happens when you feel ignored? What does that look like? What do you do? What are the behaviors? What are the feelings? What happens? So then when he disengages, what do you do? Where do you withdraw, or do you keep trying? Do you keep knocking? What happens? So we want to make sense of that, and we want to validate the secondary emotion because we can't bypass it, right? Clients need to feel heard in order to take the risk of going further with us also. So we validate and acknowledge the secondary emotion, and we reflect it in the context of the cycle. In this case, the pursue-withdraw cycle. But we stay carefully attuned and attentive to any primary emotion. So those emotions that I spoke about a couple of slides ago. A tear in the eye, a quiver in the voice, anything that, that gives you a clue as to what's happening below the surface. And initially, just like any other therapy, you may not focus on that. You want it, the couple, I always say that you want the couple to kind of wash over you, so you really understand what's happening between them and can make sense of that in terms of their cycle. So then, we, at some point in therapy, early on, in stage 1 work, we want to focus on, further develop, and distill the primary emotion. We want it to be pure. And we can feel that. There's a palpable change, feeling in the room that shifts. And again, you'll see this on the video. It'll all make a lot more sense when you see some video. So key move in EFT is the next step, which is the enactment. So once we've distilled this primary emotion, we want the partner to pass it to the other partner. We want the partner to share that. When you criticize me and blame me and get after me and bombard me, I feel overwhelmed. I don't know what to do. I feel like I can't get it right, that there's nothing I can do. So that's one layer. And then you keep going, and he might say, I feel helpless, or she might say, I feel helpless. There's nothing I can do. So I withdraw, I disengage. I don't want any more conflict. So you want to create a new message for the partner that helps the partner understand this vicious cycle that they're caught in with some new meaning. And that soothes the partner, that soothes her nervous system, or his nervous system, and you'll see it. You can actually see it once again on the video. So we want to create a new message and a new relationship event based on this new experience. And then we want to make a big deal of it. We want to process the enactment. We want to know how did it feel, how it felt for the partner to hear it, to feel it, and then we want to address any roadblocks along the way, and there will always be. You'll see. It all sounds very linear and smooth, but we need to address that. So for example, when I do that, and he says, that's right, I feel overwhelmed. You give me no space. I feel controlled by you. For her, there's a part of her that is hearing something new, and she's happy to hear that. She wants to hear that. She welcomes that. That's what she's been fighting for. But there's this other part of her that's still angry and still has felt rebuffed for however many years or months. And so it's hard for her to take that in fully. So then that's secondary. So you need to validate that also and go forward from there. And again, you'll see this move. This set of moves, over and over again in the video. So then we want to meta-process. Use summary statements to anchor the process and consolidate shifts along the way within session, but also across the course of psychotherapy. That anchors us as clinicians, and it anchors the couple as well. So Sue loves tango. So she has this nice depiction of those 5 main moves. So I think it's a really good reference for people in terms of working in EFT. So again, reflect, present, process, within, between, explore more primary, deeper, new emotions, because you're wanting them to discover and share some new aspect of themselves. And in so doing, that's going to be transformative, right? In terms of the model of self. And when they do that, and the partner is there, and accessible, and responsive, and engaged, that creates a new experience of the other as trustworthy and available, and so on. So now we're shifting toward a more positive model of self and other. And in so doing, we're also shifting in terms of our ability to regulate our affect, both personally and relationally. And that's when de-escalation starts to happen. So then we set up an enactment, make it very coherent, and they don't make that easy for you at the outset of therapy. All the video I'll show you is stage 1 therapy, and you'll see how I get blocked and how they move away from me. Because the gravity is toward the negative cycle. Not because that's what we're wired for or what they want, but because it's familiar and there's still not enough safety in the room that they just follow along with you. Then we process the enactment, address the blocks, and then integrate that into the process in terms of the view of self, other, and the relationship more generally. So let's look at some case examples. We have 3 case examples, and again, thank you so much for subtitles, Dr. Fairweather and Matt and Drago, like I was saying. And we're going to see a couple, Max and Joni. So let me just say a bit about them. So this is Max and Joni in role play. And they have been together about 8 years. Max, they're both previously married. Joni had 2 kids. And Bob and Vicky. And what you'll see on the video is that Joni says that everything changed after the loss of Vicky. That's when she reached to Max, and he couldn't be there for her in her pain. Again, not because he didn't care or was, insensitive. He thought he was doing all the right things. He was helping with the memorial and so on and so forth. But that's not what she needed. She needed someone to share her grief with. So she actually disengaged. So initially she was more the pursuer and he the withdrawer, but now they're presenting for therapy and he really wants her back. He loves her. He wants her to come home to him. So let's see what happens here. Okay, so moving out of this, in terms of key moment. Sure, thank you. Can anyone identify what the key moment was? It's when she shares her grief, right? Something. So there were lots of things. There's lots of noise in the room, as there always is, with clients, but especially with couples. And for sure, the information that they provided about Bob, I have to pay attention to and address. Also, I need to be aware of whether she has done some grieving on her own so that I can get a sense of her capacity to manage and tolerate the primary affect that I want to take her to. So for me, I want to focus her on Vicky, on her baby, because I know that the only way back is if she can share that part of herself with him, and that he can tolerate it, that he can hear it, and that he can be there for her, and not feel in competition with the kids, and not feel like he has to rush her or fix it or any of those things. So in terms of that tango, I want to deepen the experience, have her pass it to him, and then you saw me processing it with her over and over again, right? And with them both, so that I can help them to, so in EFT, we want to have an emotional experience, a bonding moment, and then we want a cognitive appraisal of that. We want to make sure that we can anchor them in that process so that they can understand how they got there, how they got to a new place, and they can eventually, between sessions, build on that. And over the course of therapy, that will get easier. This is stage 1, so much harder. And what I'm thinking, but I am open to your thoughts, is that I would like to show you the next clip. This is a couple that she's way more dysregulated. She has a very significant history of trauma and loss beginning in her childhood. And so for her, her model of self and other, if you remember Bartholomew and Horowitz's attachment quadrants, she would be in the fearful category. And she has limited capacity to tolerate primary affect. And so you'll see me working with her. And her partner, Dan, similarly has a trauma history and loss, but his capacity is a bit greater. And so is that okay? I'll show you them, and then I want to take a minute and field questions and process and discuss. Does that work? Yeah? Okay. So this session, I saw this couple. So when I do the externships, we do what we call live. So essentially, you would be participants in the externship. I would be in an office nearby with all kinds of wires that as you can see, I have nothing. I have no ability to manage, but someone else does all that. So I've never met the couple. And so they are brave. They're so courageous to give permission to come in and allow me to provide basically a consultation session. So in this case, I'm teaching in Alberta, next province over. I'm on the very far west coast of Canada. And in that province, it's rich in oil. And many people work in the far north and live in camps. And that was the case with this couple. Dan had been living and working in camps for a long time. And Becca was at home working in sort of central Alberta. And now he's decided to leave that job. And he's going to, they're learning to live together, she says. And they're really, really, really struggling. So you're going to see me work with them about 9 sessions in. And the person that you all see also in the room, her name is Lucy, and she's their primary therapist. So when we do the lives, often we'll have the primary therapist just sit. They don't do anything except just be there. And that helps, I think, in terms of the transition, because I want them to go, to go back. And I also want her, she's like, an attachment figure that provides a bit of safety and security also. So let me see, I just want to make sure I'm giving you everything. So one other consideration. In working in trauma, I love John Briere's work. And he, over the years, when we were in graduate school, he was writing a lot, and Sue integrated a lot of his ideas into her first trauma book, which she's now editing. But one of the things that I find very valuable is he talks about a therapeutic window. That people have a capacity for trauma in terms of their affect regulation capacities, but they also have a therapeutic window in terms of how much we can push them. So in working with the couple, I think about the partner's capacity for regulating affect, so each of them on their own, and I also think about the relationship's capacity for managing primary emotion, basically. How well can they tolerate it and manage it? In this case, you're going to see that there's limited capacity, both individually and relationally. So I am thinking about that therapeutic window the whole time, and especially because I'm a newcomer to the process. But I've actually watched one video, and I've also spoken with Lucy about them. So I just want you to see that. It's such a contrast. And I think it's a good example. So again, they're highly engaging, highly connected, with lots of trauma and loss. Becca is the pursuer, Dan's the withdrawer, and just again to note process versus content, and that idea of a therapeutic window and how we work with that. Any thoughts, comments, questions about anything I've discussed so far, or the 2 clips?
Who was that lady on the right side?
The lady
On the right side.
Oh, she's the primary therapist. Yes. Yeah. So she's been working with them for about 9 sessions. So we're about 9 sessions in.
And you were just invited in her therapy, or you were part of the therapy for all 9 sessions?
No, this therapy only.
Only one?
Yes. So they've done about 9 sessions with Lucy, And now I come from the West Coast to provide training, and I see them for one session, one consultation session. So you saw about, I think about 11 minutes of it. And so in terms of the moves, what am I doing with Becca? And Dan, actually. I'm trying to keep her still in her primary emotion, right? For her, the secondary emotion is like she's kind of frenetic and anxious, and below the surface is sadness, right? And then when I invite her to stay in her sadness, it's overwhelming for her. It's hard. So in EFT, sometimes we heighten, and sometimes we contain, and we do a balancing act. So there you see me doing that. And then I want to have Becca use the relationship as a resource. I want her to use Dan as a resource. And in so doing, she can begin to shift her model of self, right, again, to someone who is lovable and who can rely on another. And his model of self will shift also from the withdrawer stance to be someone that can do the right thing, that can rescue her, that can be her guy. But you can see that there's going to be a lot of back and forth. So in EFT, when there's significant trauma histories, it's going to be slower pace in session and more active therapist in terms of helping to manage and contain and heighten when necessary emotion, and then keep feeding it back into the relationship with those enactments that will create, that's where the change will be created. If enactments don't happen, nothing will happen. So that's what we will continue to do with them. Yeah. So you see me doing that, and they both struggle. Do you have any questions, or do you want to see the last part of that? And then I'm going to show you one more clip that well, I won't say anything about it. It's just a very short one. I'll introduce it in a few minutes. But are there any other comments or questions before I do that?
You are talking very quickly with them, and you put the words in their mouth.
Yes, excellent point. That's right. It's true. I am feeding them a lot. That's true. So at the beginning of therapy, so in EFT, if we had more time, we would get into this more. But we're using lots of experiential and Gestalt kinds of techniques. So ideally, we want to use the words of the client when we're distilling emotion and then having the client pass it. When the other thing we're doing in stage 1 work, which is what you're seeing now, is we're trying to reframe this vicious cycle that they get caught in the context of attachment and underlying needs. So it's true. So when I hear even whispers of "I need you," or "I want to be there for you," then I want to heighten that, and I will. It's true. I will amp it up a bit in attachment language and in the language of the more primary emotion. But I also want to be careful about that I don't overstep my boundary. That's an excellent observation, a good point, and that I don't move too far ahead of the client. So yeah, so that's the other reason that it's so important to process the enactment, because it might look very beautiful and you know, yes, I got this bonding moment, but then you ask them, it's like, oh, not so much. And actually that's what you're going to see if you want to see just the last couple minutes. But that's a great observation. Thank you for pointing that out. Are there other comments or thoughts before we see just the last little bit of this? Yeah, I think I'm here to talk. Thank you. So, comments, thoughts, questions about the two couples you've seen so far, and about the process. Were you surprised by her reaction? No, you thought it would be? No. So in terms of what happened, we distilled the primary emotion on her side initially. He's the withdrawer, and there was so much happening in the room that we would need to settle her a bit before we try to engage him, right? Otherwise, you can see there's just no space for him. It would be that would be like asking him to jump off a cliff. So we want to, soften isn't quite the right word because we use that more for stage 2 processing, but generally it just regulate her, right? Help her to stay a little bit still, so and quiet the room so that there's room for him. So we access her sadness, work with her sadness, and then we have her pass it to him. And the thing that he says is that he wants to be there for her. He wants to be her God. He wants to be her hero. But his model of self is really poor, right? That's part of what bounces up for him and makes it impossible for him he is so amazing, isn't it? It's like they have read the books. He says, I don't have the confidence. I don't have the positive model of self to take her on and actually tell her, hey, wait a minute here. If you give me some space in the relationship, I can be there for you. And it's true. He doesn't. But wasn't it amazing? Like when you actually watch it, the room got quieter and he got taller. He did get taller. But it's fleeting. It's fleeting. At this early stage in therapy, they can't sustain it. So this is the other reason that we really want to be sure that this moment, this key pivotal moment, doesn't get lost. We want to process it. And then when she says, yeah, but I'm taking care of him again, we need to acknowledge that. And then we need to weave that into the cycle. So that's what happens. That when he takes the risk of sharing with you, there's a part of you that took that in. You took that in for a moment, just a fleeting moment, but it's too hard. It's too hard. For her, basically it's too scary, right? Her model of other is such that she can't trust. She will be let down. And he's let her down. Everybody's let her down. In her brain, there is no safe place. No, she's never been able to count on anybody. So for a moment, she takes it in, and then she quickly pushes him away. And of course, that only adds to his model of shame. So as a therapist, we need to make sure we hold him in that and help the couple to process that. That it's not that he did it wrong in that moment. It's not that he wasn't absolutely genuine and beautiful and available and accessible and responsive to her. In fact, that was a huge leap. It's that it's too hard for her right now. It's too hard for her. So then you can see that by processing all of this and weaving it into the cycle, it helps them to understand. But if they don't continue, it would be hard. It would be very hard for them at this early stage in therapy to sustain that. So we need to do this lots of times. And you saw me really holding him and the way that she so beautifully and bravely pushed through the physical nausea that she felt to actually stay connected to her primary emotion and risk sharing it with him. Are there any comments or questions? Yeah. See, one more. Very different couple. Very charming. Very, very, our favorite, I think. One of them. We talked about this because, of course, Drago did all these beautiful subtitles and transcripts and so on. So, let's talk about them for a few moments. So in this scenario, I have technology and security, you're right. Thank you. Oh, you want to all right. Do you want to? Okay, all right. Keep rolling? All right. Okay, I'm happy to do so. Everyone's comfortable? Yes? Okay. Thank you. So in this scenario, we had an idea that people like to see different voices of EFT. And we also, we just have different ideas for training tapes. So Dr. Fairweather had seen this couple. Oh, sorry, that's Max and Joy. Adeline and Mo, twice. He'd seen them for 2 sessions. And he thought this would be a great couple to maybe do a training tape of some kind with. And so he asked them, and we are so grateful that they said yes. And Mo is 83 years old, and Adeline is 79. And when he came to the session, he said he thought he was in Nanaimo Wood. And so he was quite happy to be there and to engage in this. And they're very charming. But also classic pursue-withdraw pattern, with Adeline being the pursuer and Mo the withdrawer. And you know, there's all this charm, but there's also a lot of seriousness and a lot of sadness in the couple and in their histories as well. So they've been together, Adeline said they've been together 31 years. You'll hear this in the clip. And Mo's first wife died of cancer. And Mo has struggled with depression off and on for years. And she says he becomes a bear. He becomes a grumpy bear. And he attacks her. And her only recourse is to either attack back or to withdraw, to disengage, to protect herself. And there are other times when Mo just shuts down, when he numbs, detaches. He might actually disappear for a whole day into his room, she says. So there's lots of loss and trauma on both sides. Second marriage for both of them. More recently, prior to David seeing them, Adeline was very seriously considering leaving the relationship. They'd actually even been looking, Mo had been looking for a place to live. So that it was very serious by the time they came to therapy. And the other thing that you'll hear them talk about is that Adeline was spending all kinds of time with friends. And last point that we refer to in the session is that Mo has recently lost his daughter, his adult daughter, after a period of struggling with her addictions. And they've actually just gone through this not that long ago. So they too are in stage 1. And he also had a previous history of alcohol abuse, but hasn't had alcohol's not in the picture for about 10 years. So let's see if I can get over my insecurity, my technology insecurity. Maybe not. I don't want to delay. That's good. Thank you. We went everywhere together. So it was so different. So that was such a threat. So scary for him that she was threatening to leave. Yeah. They're so beautiful. It's the way that she touches him. Yeah. Interesting couple. And part of the reason I chose this couple is I just love how much it demonstrates around development and developmental transitions. And there's more tape to be seen of them, but they actually talk about, you know, we don't have much, she says, we don't have much time. And then you know Adeline well enough to appreciate what she does. She says, it's like this, and we're here. And something like that, and then she jokes in the way that she jokes with him. But you see here that when Mo shared, when he did the enactment, his experience of regret with Adeline, and his sense of remorse and sadness, his more primary experience and emotions, she softened. She felt closer to him. She experienced this moment of connection as a reminder of what it was like when they met. And as a beacon of hope, right? You didn't get the feeling that she was on her way out, especially at the end of this session. Not at all. And he said he felt a sense of relief and similarly felt closer to her and accepted, though for him, this was also a moment in which he acknowledged and touched his deep sense of shame and regret. So part of the roadmap for him will be forgiveness, right? And then, you know, I think of Erik Erikson and his theory and development, ego integrity versus despair, right? That Mo could do this work with her would not only allow him to use her as a resource in working through and grieving and forgiveness, but it would bring him closer to her, right? That they would be closer. So, as Bowlby says, attachment is important from the from the cradle to the grave, and critically important during times of stress and or key developmental milestones like this. As Mo begins to face his own mortality and looks back on his life with regret, and is able to share that with Adeline, he can begin to gain, I was so touched by that, he can begin to gain both personal resolve and self-integration, and shift his relationship toward Adeline toward a more safe and secure bond. And with this, he will not die alone. He will have her. So to summarize, it is through our most important attachment relationships that we can risk accessing, revealing, and sharing aspects of ourselves that we might not otherwise fully know, and that we can truly reach toward our full potentials. In times of stress, when we need each other most, if we can reach to the hand of another in a secure relationship, we're more likely to be resilient and to leave the situation, ourselves intact, and our views of humanity hopeful. Thank you for having me. Enjoy the conference and hold the hands of those you love. Thank you. Thank you for your beautiful welcome and appreciation. It's very touching, and it's my pleasure to be here. And I'm happy to field questions here in the room, or if you want to go, in the lobby, I'm happy to do it there also, as you wish. Yes, of course.
It's so inspiring for me to see you crying with your patients.
Yeah. Yes, as you can see, I'm emotional. Thank you. Yes, and it's true what I said to David when he asked me. That was our first video, well actually it was our second video that we did. If you at the end of that video we show a clip that we did at Ottawa U back many years ago when we were working with Sue. But that was our first training video. And it's true what I said, that I'm an emotional, I can feel, and I didn't know how I was supposed to use that. So it was through my fantastic professors in graduate school that I learned to use that as an asset in psychotherapy. Sue among others, so I feel fortunate that I landed in the right career and that I could use those parts of myself in my work. So thank you for that. Yes, yeah. Many people comment, especially on that first video, that I allow myself to feel them, to be moved by them. It is moving. When Mo cried, it's so deep and so emotional. I knew we touched something very primary for him. And that's the magic of therapy. You don't know what he's going to say. I was actually kind of fishing around for primary emotion, thinking he just lost his daughter, maybe, that's a place. Have they shared in this grief? I was hypothesizing, did they come together in this loss or apart? What happened? And they actually said that they had been prepared for it. It was almost like anticipatory grieving, that they were okay with it. And so, but for him, the grief is around his regret, right? Things that he wished he had done and didn't do, and so on and so forth. You saw it, yeah. So I absolutely love working with couples, and I jokingly said they're my favorite, but they are very engaging for teaching purposes, as you can see, and very instructive in terms of providing wisdom to all of us. So I feel so grateful that someone their age comes to us for therapy and then takes the risk of saying, yes, I would like to be a teacher in this world. So it's just really, again, another privilege. So, are there other questions or comments?
I would ask, is there a situation that you wouldn't suggest to use the EFP technique? Because it's really, you're really naked in this process. So, and I think that the child can really risk being really hurt. Is there a situation that, or maybe,
Okay. Yeah, I'm sorry, I am having a hard time hearing you. Could you? He'll bring the mic. Okay, good. Yes, thank you. Excellent. You are very good observers. I appreciate the questions and the comments and the observations.
Yeah, hello. I was just wondering, are there situations, couples, problems, I don't know how to explain, but are there really situations that you wouldn't suggest to use the EFP technique because this process is really, really, people need to be really secure because they are, like you said in the video, like they are really naked.
Yes.
And it's,
yeah.
It can be really damaging if the reaction on the other side is really, is rejecting. From the other side, you know?
Yeah, I just want to make sure I understand the question correctly. That is EFT for everyone? And do we have to be careful about their capacity to manage such a deep emotional experience?
Yeah. In which kind of situations you wouldn't suggest to use it?
Yes, excellent question. So are there situations where we would not use EFT? There are, actually. Because that's right. We need to think about people's capacity for emotion and their ability to regulate emotion. So for example, if addiction is very much alive in the room, for example, if Mo is still drinking a lot, then, and we would, at the beginning of therapy, we ask all kinds of assessment questions that help guide us in this regard, both in terms of our therapeutic window and whether it's even appropriate. So violence and addiction are two situations where we have to be very, very careful and do a very, very good assessment. Because what those circumstances suggest is that the person or the couple potentially has a very difficult time regulating emotion. And if we're going to bring emotion forward in the room, we need to know that they're going to be able to manage it, both in the room but also between sessions. So if numbing with alcohol is a means of coping, then it's not appropriate. We could do minimal stage 1 work, just helping them to understand the cycle and what they need to do to move forward. Drinking being managed first and foremost, and similarly violence. We do the same around violence. Yes, excellent question. Thank you. Yeah. Are there other questions, comments, observations?
Can I ask, what about personality disorders?
Yes, excellent question. So, what about personality disorders? If we understand human behavior from an attachment perspective, it doesn't mean that I or that Sue doesn't recognize this as a possibility, that this diagnosis exists. But basically we work the same way. So someone else might view, well, it's not the best example. Becca was very dysregulated, right? She wouldn't be called histrionic probably, but you see she's moving toward that direction. For us, we don't think, that's not what's in our brain. What's in my brain is that she has such a horrid history of loss and trauma, that her model of self is so poor, and her model of other is similarly so poor, and her capacity to regulate emotion is so poor that it's very, very hard for her to succeed in a secure. She could not, of course, on her own, Actually, I should not say she could not, of course. It's possible, and Bowlby would say this also, that we don't need to have couple therapy necessarily. If Becca, for example, or any couple, if any person who had a difficult time with those those three key aspects of attachment, ended up in a relationship where that person had a very secure history, it would be hard, because what it would mean is that that person would have to stay still. Stays very still, very solid, very predictable, and slowly her working models of self and other would be challenged, and she would slowly use the relationship as a resource. So to answer your question, we wouldn't see it any differently. And at the beginning of my talk, I talked about the work that I do in terms of working with injured workers and so on and so forth. I do a lot of assessment, and I also do a lot of psychotherapy. So a key question often is, whether we don't use Axis 2 anymore, but whether there are any personality, the DSM-5 of course, that use that, but personality traits that are at play. So it's not that I don't believe in that. It's more that I don't hold that at the forefront in terms of my work with couples. Similarly, I know I have couples who have diagnoses of PTSD, and they are seeing my colleague down the hall for individual therapy. And I know PTSD is in the room, but my focus is on how does PTSD play itself out in this relationship. So for this guy who has been in Afghanistan and now is coming back to his home, back to his family, his means of coping has been to, all the avoidance strategies, right? To detach. So the way that she experiences that is just as all the other pursuers have. So slowly we can help him to re-engage in the relationship, and in so doing, we also challenge the avoidant aspect of PTSD, which is a key maintaining factor. So it's a long-winded answer to your question about personality disorders. So it's not that I disregard or don't believe, but I work with it from the lens of EFT and as an attachment, and an attachment framework. Yeah, it's a good question.
Can I have one more?
Sure, of course.
I've noticed you explain what are you about to do.
Yes.
What's the point of therapy? Do you have a lot of psychoeducation, or how much do you also go with the rational part? The point, what's the point of therapy? What should be done? How to encourage people that that they roll with you in the emotions?
Right. Okay, if I'm understanding the question correctly, you see me in session, say what I'm going to do. I'm going to keep you here. I'm just going to, things like that. Exactly. Yes, I do. And at the end of the and part of the reason I want to do that is because I want to be intentional for me, but also for them. And you see with Adeline and Mo, they are so, we could have gone a million places, right? We had just had to be so focused with all of the couples, really. But with them, their charm can easily take us to another place, talking about her eyes and her contacts and so on. So yes, I do that for that purpose. I also do it for the purpose of bringing them alongside. That's true. And if I'm understanding your question correctly, the other thing I do at the end of the session, so in that, in the tango, you can see that initially we kind of zoom in. To access and distill and deepen the primary emotion, we lean in. And then when we have something, like I did with Dan and Becca, I have a rolly chair and I lean out. So that's the moment-to-moment processing within session. And then at the end of session, I want to do some more of that. I want to do some more processing of what's happened. And then I want to anchor that in the context of the overall roadmap for therapy. And that's important in EFT because the first stage is de-escalation, then bonding, then consolidation. So many couples, you could feel the room get quieter, with Dan and Becca especially. So you can see that by the end of step 4, in stage 1 work, they might say enough already, right? which would be okay. And especially with trauma, because that's how people work in individual therapy too often, is that they do a piece and then they take a break. But I would want to anchor them in the process so that they understand and make an informed decision about where we're at. So I do both. I do it in session, within, as you could see, and then at the end I zoom way out and do more meta-processing in terms of the overall roadmap for therapy. And again, as a clinician, it helps anchor us, and it also anchors the couple. So, yeah. Does that answer? Is that the, yeah, okay, good. Thank you. Other questions?
I would maybe ask you, when you get a couple who is about to divorce, let's
Yes.
say one is already out and the other one wants to stay in the relationship, how do you work with them? What would
Yes.
you suggest?
Yeah. It's a good question. So if I have a couple come in and one wants to divorce and the other still wants to stay in the relationship, it doesn't happen very often that way actually, but what happens very often is one person will say, I really want this relationship. I will fight for this relationship. And the other person says, I don't know. I think it might be too late. Which is sort of what you're saying, I think, right? So then I say to them that I explore that. I explore that in the context of assessment. Understand their personal histories and from an attachment perspective, their relationship history, when did it change, what happened, and I want to feel what's happening in the room. Because you can feel disengagement, right? You can feel it. And then, commonly, after a session of that, the person who is ambivalent will say, you know, I really don't know. So again, I would want them to make an informed decision. So from an EFT perspective, through the lens of an EFT therapist, one of the best ways to do that is take them to the edge, right, in terms of an enactment, and see what happens. So go through that tango and see what happens. Actually, I recently had a couple where that was the case, and I saw them, I'm not sure, maybe 6 sessions, and sometimes tears are secondary, and in this couple, tears were more secondary, and he wasn't impacted by it. But then when I took her to a deeper place around her emotional experience and her sense of regret about things that she felt she had done wrong in the relationship, what I would anticipate is that he would be somehow impacted by that, or somewhat impacted by that. And he wasn't really. He was a bit. And then people just say the words. And then I ask him, what's happening for you? What goes on for you? He says, I want to come back. I actually want to come back. I want to come home to her, but I just can't. I don't have it. So in classic EFT, at the beginning of time, when I was in those studies, Sue would have us see a couple together, and then 2 individual sessions. And then we see them for a series, tape every session, she'd code it, research, etc. Now, we are not, and in my practice, and I think generally, we're not as rigid about how we use individual sessions. But for me, that's a time when I want to do an individual session. Because I want to understand, is there another competing attachment in the room for him? It's possible that maybe there's someone else that he's engaged with, or I don't know. Or maybe there's some kind of barrier, some kind of block to connection that it has nothing to do with her. So that's what we did. And it was sad. It was too late. And they both said we waited too long. And she actually was amazing. She took responsibility for her part in it. They had done enough in terms of understanding the cycle, and she understood what happened. And they resolved to be good parents together. Their kids were older adults. So sometimes it happens, but honestly, actually not very often. It's not very often that it does. Usually when people are ambivalent, then they rekindle, because there's so much investment. And you saw that with Adeline and Mo. They were in a really serious place. And Dan and Becca also. But if there's any belief that the other person can be there, or any kind of history that, and you know, the other thing I hear commonly that's sad, and Mo actually, in his wisdom, said it too, that second marriages are harder. And sometimes when I see people in their second marriages, they say, I wish I'd met you earlier. So that is sad, isn't it? Because they understand things differently, they feel things differently. And they can see their old relationship in the context of this cycle. So, again, another long-winded answer to your question, but yeah.
Thank you.
Yeah, you're welcome. Are there questions? Okay. Well, again, I'm available and happy to meet with you and discuss as you see fit. So thank you so much again for having me.
Dr. Leanne Campbell, thank you for an interesting and a very emotional lecture. Thank you.